Hello, my name is Lucas Montag, and tonight I will be interviewing my mom, Sherry Montag, who is an adult geriatric nurse practitioner who is working as a palliative nurse practitioner within the Affinity Hospital System. Describe your work environment.
I work within the hospital systems of St. Elizabeth's Hospital and Mercy Medical Center.
What are the pros and cons of your job?
I enjoy the meeting the different people within the hospital system. I enjoy meeting the patients and finding out their story of what they've gone through with their disease process, or maybe their newly diagnosed cancer. I enjoy helping others. The cons of my job, right now, because our program of palliative care is new within the hospital system, a lot of doctors aren't exactly sure what we do, and there's a lot of identity problems and billing problems that the physicians don't understand at this time.
Describe your typical day at work.
I come in about 8 o'clock. I check the status of all my patients that are on my caseload. I meet with my whole team at 8:30. We do a huddle. Around 9 o'clock or so, I start making rounds on the floor, so I'll connect with the physician who's taking care of the patient as well as the nurse. Go in and see the patient and then meet with their family and see how they're doing. Make any medication adjustments that they need to keep them comfortable if they have pain or they're nauseous or anything. I also do consults throughout the day as well if a new patient would be referred to me. And then I finish my day by rounding again and making sure that everybody's okay, and then I go home about between 4 and 5.
How much training and education do you need for this job?
Well, I'm an adult geriatric nurse practitioner. I went to school and received my master's of nursing. So on top of regular school, about 6.5 years.
Where did you receive your education?
I went to Concordia University in Mequon.
Do you do any travel for this job?
Just between the hospital systems, between Appleton and Oshkosh. Right now, I am going to Philadelphia in February for training, so I do training out of state.
What did you consider before doing this?
I've always wanted to be a nurse practitioner. I interviewed with the oncology department to take care of patients with cancer or blood disorders, and I also teach at Rasmussen College, and I enjoy teaching.
Do you have to work on any holidays?
No, that's one of the perks.
How much do you have to work with others for this job?
I'm continuously working with people. I'm working with physicians to make sure that we have a collaborative approach to taking care of the patient. I work with social workers, chaplains. I have a nurse that I round with as well. I'm constantly working with people. You have to make sure everybody is on the same page to help take care of the patient.
How did you decide on this job?
I've been in hospice and palliative care since 2003, and being a palliative nurse practitioner was just something I just fell into. I believe I was made to do it. It takes somebody with a lot of patience and dedication to sit with somebody that's dying and help them through their final hours or their final days. I just really enjoy it.
What kind of salary would a nurse practitioner make in your position?
In my position within the hospital system, over 100,000 to start. In oncology, just to start, is anywhere from 75 to 80, and in the clinic is probably around 75 to 90, depending on if you have a specialty or not. I'm considered specialty practice.
All right, and one last question for you. Who is your favorite child?
My dog Max.
Thank you.